Hello, Dr. Suresh Siva. Thank you for joining me today.
You want the big one?
Oh my goodness, your mic's much bigger than mine. I lose. You win straight away. Welcome back to our Bone Health series here. Can I put this back?
Yes.
Here with ALTY Orthopaedic Hospital, and I'm sitting here with Dr. Suresh Siva, the orthopedic surgeon extraordinaire. So Dr. Suresh has explained to us a little bit more in depth about what's available here at ALTY Orthopaedic Hospital in terms of the machines. We're going to talk a little bit now about the alternative options. I know a lot of you might be feeling a bit scared, like who wants to go to surgery? Nobody. So what are some of the treatments? Let's recap. You mentioned earlier acupuncture, injections. So what are other options? I mean, there's physiotherapy here available at ALTY. Let's talk about that, Dr.
Yeah,
Suresh.
so we have physiotherapy here on this floor, and that's ALTY Physiotherapy. So we have state-of-the-art physiotherapy equipment, state-of-the-art machines, experienced therapists, and we also work with TAGS, and TAGS has its Tonic Asia group, and TAGS has an office in each of the 13 states in Malaysia. So physiotherapy is definitely one very important thing. You can have physiotherapy 2 to 3 times a week, and a lot of the modalities like TENS, ultrasound therapy, cold laser, all those things will help improve your condition.
So it helps to improve the pain tolerance, right, doctor?
Correct.
But if it gets to a point where you really need to replace, I mean, if you're getting to the point that you mentioned earlier, like where it's so dire and you know, you've got this kind of severe condition, right? You obviously need to do more than that. However, I'm sure you're going to go use the physio once you've had the surgery.
Yep.
So how does that work? So let's say I go in for a knee replacement.
Yeah.
So I'm out in a day or two, right? Can I go back to work? How do I function after that?
Absolutely. So what we have in ALTY, and this is one of the first things we've done, is come up with an instruction manual for the patient journey. And here you can see total knee replacement surgery.
Okay.
So, and you can see some people who are walking.
But it's not just older people, right, doctor?
No, anyone.
I mean, it's anyone.
So all the surgeons have got together and written instruction manuals for knee surgery, hip surgery, and so you just have to go through. See, one of the things that we found with our research is that the patient journey is very important. So if you have a patient journey that is the same throughout, then recovery is much faster. Everyone knows what they're supposed to be doing, and it's all in this book. So when you come to ALTY and you need a hip surgery or a knee surgery, we give you this book.
Can I see it?
Yeah, sure. We have a joint navigator, the first hospital in Malaysia, the only hospital in Malaysia with a joint patient navigator.
What does that mean?
So a joint navigator, it's not joints like what you think it might be.
Okay.
But you know.
A person who tells you, this is where you go with your joints. I'm going to navigate your movement.
So basically,
seriously, is it?
Basically, a joint navigator is a very senior nurse that specializes in total joint replacement. So this person will give you a pre-operative counseling and slides and explanation on what to expect, go through this book with you, and then post-operatively, after surgery, she will be your coach. So it's like having a personal coach after surgery to recover yourself more quickly.
The navigator.
The navigator.
She is the lady that's going to help you recover.
Yeah.
So, okay, so let's talk a little bit more about acupuncture.
Yep,
okay,
sure.
because Malaysians love, more traditional healing. Some people have said to me, you know, Sarima, I don't think I need to go for surgery. I'll just do acupuncture and I'll just live my life and I'll be fine, you know? So what's your take on that as a surgeon? I mean, maybe you might have a different perspective on that.
Well, you know, there's nothing wrong with TCM and traditional medicine and acupuncture. And all these things do give symptomatic relief. So a lot of people take traditional medicine, they take acupuncture, they take urut or whatever it is, and they feel better. And that's good.
But can it make it worse?
Unlikely to make it worse unless it's, done wrongly. But, they feel better, and that's really good. But the underlying cause is not fixed, okay? So you will feel better for a few weeks or a few months, but then it will come back. So if you want to treat the underlying cause, you need to have a qualified orthopedic surgeon
Right.
to treat you. You need advanced imaging like MRI or X-ray, and then you can fix the underlying
You know,
cause.
some people, doctor, are a bit scared of what you're going to put in their body. Like, for example, if you can just help me pull
Yeah.
this out, like all these like modern technology, titanium. When you say these words like titanium screws and all, it's a bit scary. And some people say that that's not healthy for your body, that it actually causes you to have more inflammation. Is that true?
That's not true at all, because
Okay.
titanium and cobalt chrome and polymethyl methacrylate cement, these are all very inert substances. And they've had more than 50 years of research and development, and they do not interact with the body.
Okay, so it's not going to cause me some sort of like metallic overload or
No, no.
something, you know, that's going to affect me later in my life.
No. If anything, you feel a lot better. As I said in the
Really?
beginning, you limp in and leap out.
Leap in and leap out, okay?
Limp in and leap out.
Like a frog, okay?
Yeah, well,
You got to find Dr.
or
Suresh if
like-
you want to do that.
Well, you know.
Okay, so as a few last questions here. We've got a question from Nathan from Tambun, Perak. Nathan, thanks for asking us. What are some of the common exercises we should practice after we've had a procedure? So, for example, how long will it be before a person can go back to, I don't know, running, jogging, doing their
Right.
usual workout? Is it like 6 months?
No, no.
Oh,
Again, it
okay.
depends on the procedure, and usually it's 6 weeks.
Ah,
Yeah.
that's not too bad.
Yeah. So after a knee replacement or a hip replacement, you'll be walking the next day.
Wow.
Same day or next day you walk around.
Crutches?
No, no, no. Well, depends. Depends. Some people are very brave and they don't use crutches, but we advise them to at least use a walker,
Yeah.
like for support and
Of
stability.
course.
So I would use a walker for like 2 to 4 weeks.
Okay.
And then after that, start slowly getting more independent. It
Okay.
really depends on your state of health before the surgery. So the
Okay.
more healthy you are before surgery, the better your outcome is going to be.
So before surgery, what do you advise your patients? I mean, besides lose weight, for example,
Yeah.
that would help.
So there are two things, right? The younger you are before surgery, the more healthy you are. So that means your result is going to be better. So don't wait till you're 99 years old and like super sick and then come and see you and say, oh, I need surgery. Because by that time, your joint is completely destroyed.
Oh,
It's all
no.
deformed. Do it when you're 60 years old or 55
Okay.
years old. Then your muscle is still there. Your joint is not so badly damaged. You can have a joint replacement and start walking.
Will you be normal again, Dr. Suresh? Like if I do my knee replacement, God forbid, if I need it, you know, I might in a few years. We all might, right? All of us. Will I feel like normal, or will I feel like a bit like apa itu dalam?
I mean, no. We all have friends and family
Yeah.
who've had hip and knee replacements.
That's true.
And they're all
actually.
fine. They all walk around, they're like super happy. And a lot of people who've had hip and knee replacements, your friends or family, are going to tell you that this is the best thing that ever happened to them.
Wow.
Yeah,
Okay.
most patients. I mean, obviously, any surgery comes with risks, but
Yes.
hip and knee replacement is so safe now
Yeah.
that you have a 98 to 99% chance
Of
of
it
success.
Being fine.
Yeah.
Right. So how does somebody out there, one of our viewers say, or many of our viewers, they want to come and get a screening done at HSC. So do you want to talk a little bit about HSC screening and what that provides here at ALTY?
Right. So HSC is part of our brand. It's in the same building. And basically what HSC does is the screening part of ALTY. So we do health screening, cardiac screening, all those kinds of things. You know,
cardiac as
yeah,
well.
Cardiac. We have
Yeah.
a Dr. Lee, our cardiologist. We have women's health, men's health screening packages. Now, this kind of packages, you have to do once a year.
Ah,
Why?
so it's a top to toe.
Yeah, top to toe. They check all your bloods. They check your heart. They make
Okay.
sure your ticker is functioning.
Can you hop into the EOS and
You
the
can
MRI
totally-
as well
you
as
can
part of the
totally
package?
Do that. We can do
Okay.
a coronary artery calcium scan to see how much calcium there is
Really?
in your heart. And
Calcium in my heart?
yeah, well, that's a marker. If you have lots of calcium in your heart,
That's not good.
that's not good. You're going
The
to have a heart attack.
calcified arteries.
Correct. That's bad.
I know something about medicine.
Yes. So we have a lot of patients from the Ampang area, especially Japanese patients, come for screening here.
Right.
And we pride ourselves in offering really state-of-the-art screening stuff, you know.
Okay.
Really good screening packages.
So now you know, so you just got to contact ALTY, you've got your screening packages, head to toe. You've got the state-of-the-art EOS imaging machine. You've got the MRI that you don't need to be claustrophobic about.
Yep.
And you've got 8 specialists. Let's talk a little bit about this group as a
Yeah.
whole, because there's not just Dr. Suresh Siva. As amazing as he is, he has many, many amazing colleagues here at ALTY. Would you like to talk a little bit about them?
Well, you know what they say, no man is an island.
True.
Every man is part of the continent. So we are one of the first, actually one of the only orthopedic hospitals in Malaysia, which is a true group practice. So rather than like in most hospitals, when you go see a doctor, you're seeing one doctor, and that one doctor will take you through the surgery, and then at the end of it, they will follow you up.
Yes.
So what we've done here is brought 8 of the top specialists in Malaysia to form a group as a group practice. So when you see one doctor, your case is going to be discussed at our weekly X-ray meeting, and all the doctors will have input into your case.
So if my knee's like messed up, all 8 of you will talk about how bad Sarima's knee is and how she shouldn't have gone and ran
Yes.
17 marathons in heels.
We'll talk about that, and we'll also talk about the best way to fix it. Should we do a knee replacement? Should we do a high tibial
And who
osteo-
decides who's going to do it?
Well, you will be operated on
You
by
pick a
the
stick.
no. You will be operated on by the surgeon that you see. So if you come and see me, I'll do the surgery, but I will discuss it with everyone else before doing it. So you will have
Okay.
the opinion of 8 different specialists.
And when you combine the experience and awards and amount of work these 8 specialists have done, it's incredible. So, you know,
Yeah, so
mean,
collectively we have more than
Yes.
150 years of experience. So like this morning I did my case, I did it with Professor Ruslan.
Okay.
And he was helping me.
Yes,
So-
and he's
so that's-
quite senior.
And that's quite nice in a private practice setting where you have colleagues to help you and you're a true group practice. So I think that really benefits the patient. And what
Definitely.
we wanted, our vision was to set up a joint replacement and spine center, which is a group practice. So the patient can benefit from multiple specialists' opinions. And that's how it's done in like the US, or
Yes.
the UK, where you have a lot of people giving their
Collectively.
input. And collective treatment is much better than a single.
One person,
One
and then you've got to
person.
go for a second opinion, third opinion, fourth opinion. By the time you get the 7th opinion, your joints are painful, your knee is sore, you need to go home and sleep.
Yeah, you need to go home. So
Okay,
here
we
you
don't
have
want that.
all the 8 opinions in one.
In one place.
In one place.
Okay, so it looks like, you know, we've pretty much covered everything that we need to cover.
Yeah.
One last thing I'd like to ask you, Dr. Suresh. What about you? What are some of the joint pains that you experience? You're a surgeon. You spend a lot of time, I'm imagining, doing this, don't you?
I do.
So who treats you?
Well, you know, that's a very good question. I'm very fortunate in having excellent colleagues who I can go and see.
One of the 8 collective
one
minds.
of the 8 collective minds, or I can go to ALTY physiotherapy, and I
Right.
really do a lot of stretches before and after surgery.
Okay, so your hands or your neck? What usually is
Mainly the
painful
neck,
for you?
mainly the neck, because a lot of surgeons are down like
Yes.
this. So you have to tell yourself, sit up, you know, and look up. after
All of
surgery.
us
All
do.
of us. And the other thing, if you're working on a desk job and you're sitting all the time, every hour make sure you stand up and take a little walk. In fact, the Apple Watch now reminds you to do that. Okay, we shouldn't be doing product placement, but
That's
any
fine.
smartwatch
Okay.
will remind you to stand and walk
Yeah.
after 1 hour. Why? Because human beings were not evolved to sit in a chair. Like,
Well,
you know,
that's why you have some office cultures in other countries where you're actually on a treadmill or you're standing desks,
yeah.
right? So those are
yeah.
better,
If
obviously.
you look at evolution from like the Stone Age, and we were all
Yeah.
running and jumping.
Supposed to be.
Supposed to
and
be.
handphones.
Oh, that's the
Dr.
worst,
Suresh.
yeah.
So what do you think about the smartphone usage? I mean, because most of the time we're like this. Maybe some of you are actually watching us right now like this.
Yes.
So maybe you want to lift us up right now.
Yeah, lift up. and you know, with your thumb, a lot of patients come with pain in the thumb.
Yeah.
Because overuse of smartphone.
Messaging.
Pressing,
swiping.
swiping. So take a rest. You know, maybe don't use your right hand. Practice with your left hand. Give the right hand a rest.
Yes.
And sometimes it helps if you have a wrist brace or something to rest the wrist and the finger, so you
Great.
don't overuse. And that can be dangerous. When you get overused, you can get things like carpal tunnel.
Right.
You can get decurvent stenosynovitis.
Trigger finger?
Trigger finger. A lot of these things can manifest if
Okay.
you don't pace yourself. I think
Pace
nowadays
yourself.
telephones have got screen time alert.
They do, but
right?
really, honestly, Dr. Suresh, none of us care about
Care
that.
about
It's like your screen time's up 15 hours. You're like, wonderful! I beat my record last week. You know.
But we see a lot of people, especially younger people with wrist pain and hand
I
pain.
can't help when I'm around you, but I automatically start feeling the aches and pains in my body. I'm like, I need to go fix my elbow. I need to fix everything.
Definitely take a break. Don't use your right hand. Use your left hand.
All right. Well, thank you very much, Dr. Suresh Siva here at ALTY Orthopaedic Hospital. A guest here with me. I'm actually the guest here, sitting here today in this wonderful looking hospital, very modern. This is just a part of our bone health series. There will be many, many more. I'm really looking forward to it. I hope that all of you gained as much knowledge as I did today. And once again, thank you, Dr. Suresh. Do follow us on all our social media platforms, ALTY Orthopaedic. Tag us, and don't forget to contact us if you just want to do a general screening, or if you're starting to feel the joint, bone, muscular, skeletal pains. The word quite long.
Long word, yeah.
Skeletal.
Yeah.
I had to do that a few times at home. But
call us.
Yeah, so if you have any pains and aches, basically, prevention is better than cure. Dr. Suresh is one of the 8 collective minds here at ALTY. So we hope to see you soon. All the best. We want to add life to your years. And take care. Stay safe.
Thank you, Sarima.
Thank you.
Thank you.